Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Right, so we are here at NCPDP Annual Conference 2026, and I am thrilled to have Kim Boyd joining us for our NCPDP Unscripted podcast. So Kim, welcome.
Thank you, Pooja. It is so great to be here. You guys have been doing such incredible work and with the Unscripted podcast, so I'm really excited about this.
Thank you. Thanks so much. Appreciate it. All right. So I think a lot of our members know you. Some of our non-members may not know you. So first tell us who you are, where you work, and a little bit about your background.
Yeah. So Kim Boyd. Right now I'm a principal at Leavitt Partners, but I've been in healthcare for a little over 30 years, both working on the medical and the pharmacy services side. I was introduced to NCPDP a solid 26 years ago. But for Leavitt Partners, a principal really doesn't tell you a whole lot, but a senior executive with them, and I help coordinate on policy alignment with our clients and also do collaborations, putting alliances together on very unique issues that need to be solved in healthcare. But we help clients align on policy and digital health modernization and kind of what's coming around the horn in healthcare.
Fantastic. And you are also a member of our board, so super excited to have you be working with us on that as well. So I do want to dive in today on one of the alliances that you've created under Leavitt, called PICSA, if I'm saying that correctly. So the Pharmacy Interoperability and Clinical Services Alliance. So tell us about that alliance and what's happening with that work.
Yeah. So I'm an executive director of that, and we've brought together folks across the ecosystem who want to focus on modernizing and empowering the pharmacist as a clinician that's doing clinical related services. There's been a lot of effort, that's happened across the industry between standards bodies like NCPDP, but there really hasn't been the scale for modernizing and supporting the pharmacist as a clinician. So we've brought together standards bodies like NCPDP and health tech vendors and pharmacies and pharmacists and health plans to look at the core issues that need to be solved for and how can we do those implementations and actually do real work that can hopefully be replicated across the states and continue to show the value of the pharmacist to the patient.
Great. So let's dive into some of those obstacles. Tell us a little bit about kind of what's stopping a nationwide kind of, uptake of these services.
Yeah, I think probably two core things. There's really a lot of core things, but there absolutely needs to be greater billing pathways, greater opportunities that are more standardized billing pathways, and pharmacists can count on that they're going to be paid consistently by health plans to perform the services that they're scoped for. Some of it too, there's 50 states with 50 different rules around what the pharmacist is scoped for. But we also need to create the infrastructure and have a very consistent infrastructure for the pharmacist to be able to utilize. I think pharmacy was created on dispensing systems, and that's what they focused on very clearly and been very successful there. But they really don't have a pharmacy management system like other clinicians have, to help guide their documentation, to help guide in a coded way, documenting, credentialing them. There's some challenges with getting pharmacists credentialed quickly because it's really not standardized for their scope of practice. Right. So we really need to modernize that, standardize that, and get a few of those things solved for.
That's great. And we just had Bridget Groves from APHA on who said the same thing. So, I'm starting to hear these themes really across so many initiatives and groups and alliances that are out there. So it's nice to see if some focus on it. So it's been good. Yeah. So I think Medicaid, if I'm thinking about this correctly, in some states, Medicaid plans do pay for services. Are there certain states that do that?
Yeah, there are several states where not only Medicaid, but even some commercial payers and self-funded employers are starting to do some of that. But Medicaid is definitely the path right now. But again, while they're doing that, there's still some challenges, right? You could have 5 MCOs in a state. And you could have 5 scopes of practice for the pharmacist, but one MCO pays for 2, one MCO pays for 1, the other ones pay for 3. They have fee schedules that vary, so you're doing a test to treat for one, you're getting paid differently from one than you do for the other. So consistency needs to happen. And credentialing, I mentioned it earlier, really, if we could get pharmacists, it usually takes them anywhere from 3 to 8 months to get onboarded, depending on the payer. If we could get some standardization there and some modernization there and get them onboarded more quickly, then obviously they can start treating patients and getting paid for that more quickly as well. But it varies a lot.
Yeah, I'm sure. So I know just from working with Leavitt before, a lot of what you guys do is, pull together alliances, but also do pilots. So I think you guys have a pilot that you're starting to think about or pull together. Would love to hear a little bit more about that pilot that you're thinking about.
Yeah, we actually have three kind of pilots that we're looking at what we can do. The first one is really around how to automate and get real-time information flowing from the pharmacist to other parts of the care team. For example, I want to order a lab. How can I automatically send that off, get the lab detail, get the lab to respond, comes back into the pharmacy system, and now they can take action on it, depending on the lab. It's an A1C check or something that now they're coming up on an encounter with the patient. So being able to document that consistently and get that information flowing freely is one of the things that we want to do.
Right.
And once the pharmacist gets it, maybe they're also working with a care coordination company. How can they make sure that care coordination company gets the lab related detail too? So now we have we have longitudinal records that are the same, right? So we'll be working on real time clinical data exchange with a test on lab data right now.
Oh, that's fantastic. And what about the other two that you guys are
So we definitely want to look at how can we modernize billing a little bit more? How can we get more consistent with billing? On the dispensing side, most pharmacists get paid in about 14 days. There's consistency. They know what they're going to get paid. Most of the time they know, and it's consistent. We want to be able to automate the billing process and do it more in real time with the right supporting documentation to go with it so that there's billing clarity and less chance of denial on the claim. So we definitely want to do that. We're also looking at potentially digital insurance cards and how can the pharmacist as a clinician use that to confirm coverage before the patient comes in for an encounter, as an example, to reduce that administrative friction as well and consistency. They know that they're covered and they can provide the care, and therefore they hopefully can get paid on the back end.
Yeah, that's fantastic. All right, I'm going to switch gears a little bit because you're on the board, but we're chairing our SPC, so the Strategic Planning Committee, and I know you are also part of a subcommittee on that around standards adoption and certification. And so talk a little bit about kind of efforts there and what you've been doing with the Strategic Planning Committee.
A lot. So, we have 3 pillars under the Strategic Planning Committee. I think a lot of focus, obviously, is organizational excellence, and that's how do we operate internally, organizationally. But we have collaboration and also data exchange, clinical data exchange. So, think about the work that we've been doing there and how do we educate folks on the opportunities with TEFCA as an example? And could the TEFCA exchange be a way for the clinician, the pharmacist to get information, right? In the Sequoia project that you're co-leading there, we've learned so much. You guys have created those use cases. So our subcommittees and committees internally here at NCPDP have been focusing on that. And how do we continue to advance knowledge and education and create an environment that the pharmacist can practice at the top of their license using those networks, using the HIEs, informing and things like that. And that's what we're bringing into PICSA. Some of those learnings we're bringing into PICSA. How do we collaborate? How do we share information back with NCPDP and with others like Pharmacy HIT Collaborative, Sequoia as well, what we're learning. But how do we take what we're learning from the standards body and do that? Certification has come up as is that a potential opportunity to build a trusted system that exchanges information more consistently in a codified way, in alignment with what the Office of National Coordinator created for the EHR systems and the HIEs and HIN. So it's definitely been a circular.
Yeah.
What we're doing here at NCPDP is flowing through to the alliance work for enablement and coming back. And I think the SPC has done a really good job on execution and kind of finding those understanding nuggets that the industry can now take on and start testing.
Yeah, that's great. And I mean, we've both been in this industry for a long time, so it's nice to see that so many organizations are really kind of marching forward together with the same kind of purpose and goal. So it's nice to see that. Yeah. So
it's been very uplifting.
Yeah.
To see, it's been challenging.
Yeah.
But it's definitely there is momentum.
Yeah.
And it's really cool to see the momentum that's happening all across.
Absolutely. Yeah. So is your ultimate goal to try to, at a federal level, get consistency? Because I know, across the states, right, it's very, like you said, it's really disparate. And even within certain states, there's different things. Is the ultimate goal for PICSA to kind of be able to test things and go get this federal kind of legislation going? Or?
Well, it's actually absolutely to test real world opportunities, showcase what we learned from that, showcase the value, continue to showcase the value behind the pharmacist as a clinician, which will help inform those organizations who are pushing for federal policies that support the pharmacist as a clinician. We know that Medicare does not recognize them yet, but I think what we learn out of these testing events and piloting events, which we eventually want to scale, I think will inform the NASPAs of the world and the other associations who are looking to drive federal policy for sure.
That's fantastic. Yeah. Well, I know we need to wrap up. So, Kim, any other just final thoughts on all the wonderful work that you're doing in industry?
Yeah, I'm just thrilled, honestly, that we now have what feels like this, again, momentum that's moving toward collaboration, scaling, supporting, similar messaging that can be picked up to continue to advise health plans the value of the pharmacist and create an infrastructure that can be utilized at scale, that can be consistent and standardized and modernized at the same time. Yeah, I'm just thrilled where we're going.
Yeah, me too. Well, thank you so much for taking time out of your busy schedule.
You're welcome.
And joining me on the podcast. And I look forward to following the work that PICSA's doing.
Thank you. I look forward to having you fully engaged in all that work, Pooja.
Oh, we will be.
Yeah. No, I really appreciate you, and I appreciate being on. This is great.
Thank you.
Thank you.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.